if you can't put it on a whiteboard, you can't put it on a piece of paper or an Excel spreadsheet, you can't make it happen. If you're going to go week by week, it will never happen. Hi, everyone. Welcome back to the podcast. Welcome, all new listeners. For those who are following along, I have a good one for you today. Today, we are reviewing a fantastic topic, step-by-step progressions for specific injuries. But before I do that, I got to give you some updates about life, about things that are going on, things that are coming down the pipeline. Life is good for me. I've got a lot of good things happening with my family and professionally. And my kids are growing up. Sports performance, we're in a growth mode at the moment. Fitness is good. I just started a cut week, like a calorie, sodium, carb cut this week, and we've got 20 new members, 20 total members in this group. And all we do is we basically support each other through this madness. So it's a significant calorie cut. It's a significant sodium cut and a significant carb cut, and all it is a great way to kind of we use it as a gut check, as a way to just test your strength, your will, and just to reset and all your eating habits and everything else. So I'm going through at the moment. I'm currently on 1,850 calories. And I think 500 milligrams sodium and very, very low carbs. So it's been interesting, and the fog is starting to kick in the brain. So there you have it. I'm on my cut week. All right. Nonetheless, let's move on to the podcast. So how did I get to this podcast? What is this topic about? I think it's important to know that yesterday at our team meeting at Sports Performance, one of the topics we covered was an MCL rehab progression. And I want to share with you some of these case studies because I think they're very applicable. We had the meeting and then had a conversation with a team member afterwards. And as we go through more and more scenarios, I have to share that sometimes the same scenario happens within normal tissue healing guidelines, and it becomes very challenging to see from a greater perspective how everybody you've ever treated can be categorized into certain categories of healing, and then you just insert and change out the body part. So let me explain. So we have a client who's an athlete, and they injured their knee, and they are looking to get back as soon as possible. I don't want to give all the details, but ultimately we're trying to get this person back ASAP. And the question became, how soon can we get this person back? And for those of you who listen to my podcast, you know I'm passionate about this. If there's one thing I'm really passionate about, there's SI, hips, and low back. But then on the flip side is progressions, like soft tissue healing progressions, work backwards. Are we going to put them in the game? Are we not going to put them in the game? How soon can they come back? What would you do at week 3? What would you do at week 17? What about week 63? I don't care. Like, I love that because it's very predictable, and I love predictable processes that are objective and sequential, and you can actually put it on paper. And one of the things that I want you to understand, whether you're a new grad or you're a student physical therapist or you've been out for a couple years, I want you to understand one thing. If you can't make it happen on paper, you can't make it happen at all. So what I mean by that is, if you're new to the rehab progression world, and that doesn't mean that you haven't been practicing. You can be practicing 10 years and not see the light, not see how to rehab somebody progressively over time for up to a year or more. Because a lot of times, if you work in an orthopedic setting, you're not given the opportunity or permission to do so. And when you are allowed to see somebody for a year, or you push somebody to be rehabbed for a year, and rehab is a very vague term, but can you rehab or progress and return to sport somebody for 9 to 12 months out? And because you haven't had that opportunity, one of the best things I tell people to do is map it out. If you can't put it on a whiteboard, you can't put it on a piece of paper or an Excel spreadsheet, you can't make it happen. If you're going to go week by week, it will never happen. It won't go the way you want. You're not going to be prepared. It's just like accounting and banking and finance. Like if you can't see it on a sheet, it's never going to happen. You can't just have a plan and then hope it happens. There's a difference between implementing and success. So if you don't implement, you can't be successful. So when you are looking at a progression. So I'm going to go through this rehab progression, but what I want you to take away from this is that being able to map this out. So I'm going to, whether you're on audio on the podcast or you're on video on my YouTube channel, nonetheless, you have to grasp the concept. You got to map these people's progressions out. If you don't, you will be just like every other physical therapist, going week by week, hoping that things just get better, or even worse, just forgetting about that client or patient. And then when they come in, you're like, oh yeah, I forgot about you. And then you just try and create some creative exercises that you're not really progressing people. You're not pushing them to what their limit can be. Now, the difference between treating pro athletes or high level athletes or collegiate athletes is they usually have a deadline, a timeline to achieve, and you have to work backwards. Now, what you have to do is that a lot of time sufficient to be healed to return to sport safely? That becomes a question. Well, now, when you deal with community members who not necessarily, they don't have a deadline, they don't have a 5K to run, they don't have a competition to run or a competition to perform, that becomes very tough to work backwards. So you always have to create goals. So you have to know where your goals are and your objective measures in order for you to work backwards. So let's go through this case. All right. So we have an athlete, a multi-sport athlete, with a grade 1 MCL sprain. Okay, let's just, I'm going to give different facts about this case and make it a little easier to digest. You have an MCL a grade 1 sprain, okay, 48 hours old. Okay, get them in the clinic, can rehab them. Now, the question becomes, how soon before I get back to playing? So let me give you an age. I'll give you, let's say 18, okay, 18. So they're fresh out of high school, into college, and there's something we call youth juice. Youth juice. That's the ability to regenerate and recover at an exponential rate, and that usually starts to end around 18 years old. So we get these middle school and high school kids, and maybe you have too, like they have an injury and you're like, oh my gosh, this is going to take 3.5 weeks. You won't be able to play at week 4 and it's going to be questionable. And then next week they're like running. We've had that happen before. We've had ankle sprains, grade 2, ecchymosis, edema, and they play the next week. And we're like, wait a minute, how did that happen? Youth juice. It's just something that they have that we don't as adults. So this person is kind of losing that aspect. And so if you have a grade 1, let's go just normal ligamentous timelines, okay? So in the first 72 hours, you got the swelling, you got, antalgic gait. First 3 days, you've got soft tissue healing, immediate, okay? After that, you got 2 weeks to get them non-antalgic gait, get the range of motion. You've got 2 to 4 weeks after that, at the 6-week mark, to get them with a grade 1. Let's just play like normal timelines for a normal community member, and then we'll work backwards with pro sports, or professional athletes, collegiate athletes, and youth juice. Those are different animals, different ball games. But if we talk about a normal community member, healthy, active, just love staying healthy, you're at that 6-week mark for that grade 1 to heal. Grade 2, grade 3, you're looking at 10 to 12 weeks. So knowing that, let's work backwards. So this person is a multi-sport athlete. They have to be able to cut, so that makes a big difference on this MCL. I want to share a checklist that I've created and I've shared with the team. And it's a checklist that I personally use. If you ask me, what's your algorithm on how you progress an athlete all the way through? And on the initial evaluation or in the initial visit, what I'm going to use is this checklist to help me run a step-by-step progression on deciding what that plan of care and what the progression is going to be. And here's what it looks like. All right. So step number 1, I'm going to assess the body part. Now I know it's a knee. What's their sport? What's their position? We got multi-directional athlete, and they enjoy, let's say, soccer. Okay. What's their training like? How many days a week? This person's doing 6 days a week. So 1 game day, 5 practice, 1 full recovery. Their frequency of training, and the type of training. Um, and then, and recovery. So what do they normally do? Is a Sunday's full day off, or what are their lighter days? That way I can put it in my plan, and like if I know what they do on a day-to-day basis, then I can insert what they're still allowed to do. All right, so let's go through the symptoms. Tenderness to palpation, a little posterior swelling, posterior medial swelling, just from the contact. So it was a contact injury, contact MCL sprain, uh, and their symptoms are pain with walking, full extension, flexion beyond 90. What's their phase of healing? They're definitely in the acute phase. They are not feeling really good. So, what's the timeline? Ideal world, they'd like to be back within the next 2 weeks. All right. So, once we know that, we can kind of set the stage. Now, what previous therapy have they had? It's irrelevant here because we now need to know, because we're the first responders here. So now we can manage this moving forward. But if you had somebody who was 3-4 weeks out, you do need to know what they've had in the past. Why? Because you don't want to overstimulate. If they're seeing other providers, they're seeing a massage therapist, they're seeing an acupuncturist, you need to know, because what you need to know is who's the quarterback at what time. And what I mean by a quarterback is who is the person leading the rehab at what stage of healing. And for some of you, that's foreign because maybe you haven't worked with enough, worked in conjunction with other providers. And what I mean by that is if you have somebody in the acute phase of healing, are they seeing a physician? Are they seeing you? Are they seeing a massage therapist? Are they seeing an acupuncturist? Are they seeing an athletic trainer? Who's managing the acute phase? And you can't say everyone because that person is lost. Imagine an athlete trying to have 4 different coaches tell them what to do. They're like, I don't know what to do. Somebody needs to quarterback that stage of healing. And then who manages the chronic side, and then who manages the return to sport side, and who does the plyometric side, and who does the strength side. And so if you're that one-all provider, good for you. You better have this arsenal, and you got to have this mapped out, or else you can't go week to week. You will set them up for failure, and that's your fault. That is not the right thing to do. That is a waste of their time, and that's because you had lack of preparation. And so the best way you can prepare is going through this progression. So if we want this person to be back at 2 weeks, we have to say, is that reasonable? They're 20 years old. They don't have the youth. Sorry, 19 years old. They don't. 18 years old. They don't have the youth juice. They play soccer, multi-directional, and they want to be back in 2 weeks after an MCL grade 1 sprain. All right, is this possible? All right, so on presentation, they have the normal stuff. You do diagnostic testing, and everything comes out negative, and it's only positive for a grade 1 MCL, tenderness, palpation, flexion beyond 90, little soreness in full terminal knee extension, and swelling, and mechanism of injury was a contact valgus injury. So, besides, I don't want to go through every single exercise that you can do because I think you can YouTube that or Instagram or whatever the new platform is to be able to support you with like tactical exercises. Beyond that, because there's going to be 50 different variations, and I think that you can come up with that on your own. I think that's great. So the question becomes, besides exercises, what are you going to do in an ideal world? If you can build this out on paper, what would happen at week 1? How many days a week would you see him? At week 1, what are you doing? Range of motion, soft tissue swelling, and gait training. Okay, what are you doing at week 2? And week 3 and week 4? And if they want to go back to sport at week 2, you better realize what percent could they possibly be going into week 2. Now, everyone's different. You don't know their healing, but what you need to do is have a projection. How much better do you expect them to be at week 1? All right, so if you know my progressions, here's what I would say. Week 1, 25%. Week 2, 50%. Week 3, 75. Week 4, 85. Week 5, 89.6. Week 6 is 90%. So that's assuming they're a community member, they don't have a deadline, whatever it may be. Now, the question is, can you expedite those percentages? And it becomes not about exercise, it becomes more about environmental factors. So let me explain what I mean by that. So Normally in a rehab setting, you work on the treatment, the assessment, the fancy whatever you want to do the gonimetric, whatever. That means absolutely nothing in the grand scheme, because now you have to project, can this person play? Because you got to have that conversation, and that dictates what your treatment's going to be. So instead of going treatment forward, I'm going to go projection backward, and then allow that to dictate what your treatment exercises are going to be. So environmental factors. Let's talk about management. What in their ADLs would decrease their healing or impact or impair their healing? All right, number one, ADLs. Let's talk about sit to stands. Let's talk about stairs. So in an ideal world on an MCL, you want that thing to come together as much as possible. And an MCL is going to be stretched for sure past 90 degrees of knee flexion. But ultimately, in an ideal world, you would lock this into extension. Now, you can go two different frameworks. Are you anticipating that they're going to go back fast and you want to heal this? So you can go conservative, brace them, lock them to extension so they have some healing, and then once you have some healing, then start to bend them, add some load. What I'm saying here is don't bend them beyond 90. Especially on a grade 1, they're not going to love it. It's going to put that thing on stretch and they're not going to feel good. It's going to impact their healing. What I'm saying here is if you can't expedite the healing, what you can do is minimize the impact or the negative influence on the healing. So on the ADLs, you're going to have trouble going downstairs, up and downstairs. So what I would do is uninvolved goes up and uninvolved and involved goes down on descending. However, little trick I learned with some pro athletes, you turn them around, make them go backwards, and that way they don't have to irritate that knee, and it's less knee flexion. So stairs, sit to stand, same thing. Make sure they're keeping that thing straight and it's not the one raising. I know this sounds simplistic to you, but if you're really like in the pro world, you have to limit all factors that can limit the progress on this thing. And that's how you have to think. It's not about what's the best exercise to activate the VMO. It doesn't matter. Minimize the reduction of stress first, and then you can add in all the spices that you want. You can be the main chef that you want. All right, occupational demands. At 18 years old, this person's a student, and so they sit a lot. What I would do is make sure the leg, that involved leg, is straight. Do not bend it. Leave it locked in. Now, what do you want to add in for taping and bracing? Put them in a brace. Now, don't tell me like a brace is going to make them weaker. You're talking about soft tissue healing. How do you maximize this person's healing? I'm not talking about what the latest research is to, for a community member. I'm talking about game time. And if you've never managed a pro athlete or putting somebody into play, you got to imagine. I told my team yesterday, stop being a physical therapist and start being a human. Now, when you think like yourself, right, you're a different person. You're like, if you had an MCL sprain, would you brace yourself so you can heal and give yourself a better timeline and expectation to be able to play in 2 weeks? Yes, you would. Why? Because you're going to throw everything, the kitchen sink at this knee to give you the best possible outcome. So take all the outside factors. Let's talk about like being a human. This athlete wants to play. And if it's a scholarship opportunity for a D1 soccer player, you better believe we're going to throw all of this stuff at that athlete. If we only have 2 weeks, guess what? The sideline leg raises and the bike and the quad activation and glute, like that's not going to do it. You want to minimize all the stress. So I would brace this person. I would tape them every day if their skin can handle it. Give them support. I would have a neoprene sleeve on this thing, swelling reduction, brace them, lock them into extension. If they need to have a little bit of flexion, I'd block the 90 degrees. Tape them every day, neoprene plus brace, all waking hours. Don't allow them to flex their knee at night. Have it elevated, knee extended. All these little tricks are massive to keep this thing healing and away from all the irritants that would delay healing. Okay, so we talked about ADLs, we talked about occupational demands, we talked about the taping and bracing. Now, the psychological aspect of this. All right, this is a big one, and you need to put yourself in this position. If going to PT school was on the line for you, and you had something come up, you would make every effort to try and make it to PT school or take the GRE or whatever it is. And if it took all this time to prepare and something happened right beforehand, you better believe you're going to take every effort to make anything happen to ensure that you achieve your goal. Now, if that happens, you better believe that your mental strength, you're going to be challenged mentally on what that means. And you as a provider, if you've heard me in the past, you understand that I think that we as providers are like 9 or 10 different providers all in one. We're not we're not phenomenal at massage. We're not phenomenal at mobilizations or grade fives or manipulation, whatever you want to call it. We're not phenomenal at medications. We're not phenomenal at reading MRIs. We're not phenomenal at being a sports psych. We're not phenomenal at being a nutritionist. However, we have the capability, the basic knowledge to help support somebody in each of these aspects and rehab them or while they rehab. And what that does is it puts you in a unique position. If they're here to rehab, you can add little elements. And so you definitely have to be a sports psychologist at this point. But you don't have to like delineate it and be like, well, you're injured, so now I'm going to be your sports psychologist. No, you're injured. How are things at home? How is school? Keep their focus, keep their attention, keep their motivation high. And when you do this, it allows them to heal because like not only are they injured on that knee, but they're also injured in that head. And what you need to do is help keep them positive, keep them mental focus. We know that if people believe they're going to get better, it actually is going to help them fulfill that mission. And if they don't believe they're going to get better, well, guess what? They won't. So you need to help them in that aspect as well. So keep in mind the psychological factors. If you see them down, lift them up, keep them pushing and motivated, always moving forward. If you end up on my table as a client and you have an injured knee, I don't care if you're a physical therapist, you're a physician, you're a chiropractor, you're a dentist, I'm going to treat you the exact same way. I'm going to treat you like an athlete, and you better believe I'm going to push you and keep you motivated because I know what that feels like. And I'm going to treat you like a pro athlete. And if you need to consider that this is an MCL on a 18-year-old multi-directional soccer player, guess what? The same principles can be applied to a 27-year-old weekend warrior basketball player or a 42-year-old professional football quarterback. You better believe the same things happen. So I'm just breaking down the fundamentals. Notice how we haven't even talked about exercises. Exercises are that's the icing on the cake. The layers, the foundation is this. Okay, so we went through ADL management, we went through occupational demands. Just if they're a soccer player, great. But if they're a factory worker, a community member, you kind of have to put those in. Like if they stand for a living, you might have to see if you can get a doctor's note to put them in sitting and maximize recovery. But these people usually this is their full-time job. They are a student, so I think a lot of people are virtual at the moment. So if they're sitting for a long time, they just need to keep that foot elevated and straight. Taping and bracing, and just keep their motivation high, right? So now that we know all of this, now we can establish the greatest, best plan of care, knowing that we have all the information, we have a timeline of 2 weeks. So if this were going to go backwards, you got to understand, if you have 14 days and 3 days already have been wasted on soft tissue healing, now you have 11 days. How are you going to get 11 days to return to sport? So if you're going to return to sport, you got to have contact. Or what about this? Let's go non-contact practice, multi-directional. Let's assume on Friday, let's go Saturday is a game, Friday is a light practice, walkthrough, drills, and Thursday is a little bit of a mini scrimmage with a little bit of contact. So let's assume they go non-contact on Thursday. They have to be able to go multi-directional, so you do multi-directional testing on Wednesday. Let's assume they had lateral on Tuesday, linear on Monday. That means they had to start jogging on Sunday. That means they had to have been able to accept load and plyometric on Saturday. That means on Friday they had normalized gait and ability to step up and down. Sorry, let's go step up and down pain-free. That means on Thursday or Friday they had normalized gait. That means on, Wednesday, Thursday they had normalized range of motion. Do you see how, like, working backwards, this person's healing needs to be like pristine in order for this to happen? And if it doesn't, then all you're doing is pushing everything back. So on a community member, if we said 6 weeks was the time to heal fully, that we know at this point, then we would say 6 weeks is, return to sport. That week they're doing contact. The week before that, doing non-contact. So at week 4 they're doing linear, lateral, multidirectional work. At week 3 they're doing strength work. At week 2 they're normalizing gait, and week 1 you're doing soft tissue healing. Very possible at the 6 week mark. If you can't work backwards, it's not possible. Your exercises are irrelevant if you don't know what your target is. So week 1, range of motion, get everything swelling reduction. Week 2, get some, normalized walking, work through some normal progressions. Week 3, start strengthening. Week 4, work on linear and impact. Week 5, lateral, multidirectional, non-contact. Week 6, contact, to be ready to play at 6 weeks. If they cannot achieve that, they're just going to be just shift the whole progression over a week or 2 or 3. But you know what's going to make it worse? Where you would put your most bang for your buck. Don't mess them up in the first 2 weeks. Let that first phase of healing happen. Don't be Superman. And this is where I have the biggest challenge with students, new grads, established people who work in an orthopedic setting and haven't managed people who have a deadline and they've not seen acute injuries as much. And what this does is it messes them up and it shifts their whole progression weeks down the line. So in the first 2 weeks, don't touch it, leave it alone. Don't be Superman. Don't be doing like plyometrics and high level stuff. Treat them conservatively, but if you map out the next 4 weeks, they understand, like, we're doing this for a purpose. First 2 weeks, just buy you some time, let the healing happen, stay mentally strong, allow yourself to get fully healed, focus on what's coming up next. You got 4 weeks after that to crush it. But if you mess them up in the first 2 weeks, it's significantly, exponentially going to delay their healing. So in the first weeks, be conservative. The next 4, work them out. But in a timeline like this, where I have an 18-year-old professional soccer player, this is going to be a tough timeline. And we had a good question. Is it our job to get them back to 100%? Our job is to get them back safely. And if they're an adult, they're going to make that decision. But you got to give them the repercussions or the possibilities of what they can do to this knee and what that means for them. And your job as a rehab specialist or healthcare provider is really to do that, is to give them the outline, make sure that they know where you're going to take them. And if they don't understand that, what they're going to do is assume that you're going week to week, and mentally that doesn't allow them to prep. And all you're doing is increasing their anxiety. They don't know where you're going to go. It's like not knowing what's going to happen next week. And as an athlete, this is their identity, this is their income. And that gives them a lot of fear. And what you need to do is control and manage those variables. The best thing you can do is tell them what the timeline looks like. Give them the expectations. Once you do that, they now have a realistic expectation of what's to come and something to focus on. It is the job of an athlete. They have that's their whole life. This is who they are as a human. And if you are a pro athlete, whether you're a physical therapist or a student, this is who you are. Let me just explain this to you. If you're listening to this podcast, I promise you, you are super passionate. You're going to be doing big things in your life. You want to be successful. You want to be the best in whatever you do. And if it was sports, you better believe you wanted to be that pro athlete, or you had that potential, or you had the work ethic, you had the skill. And these people think like you. And if you were injured, you want to know day by day progressions. And if you don't do these progressions, let me give you a little reality check. It's because you don't know how, or you're lazy. There's two things. You have the skill or the will. And if you have both, you're going to be a fantastic clinician. If you have the skill to do it, great. If you don't, then build it. The will, I can't change. Like if you're lazy, that's a different story. Like, so you just need somebody to like shake you and like, come on, like pick you up for the same reason this athlete needs that motivation. Like, let's go. So, but if it's a skill problem, there's not a lot of it's pretty basic, guys. You've learned this in PT school. I think that the problem is you're trying to consume too much. Like, zone out. see the rehab progression on an MCL, 18-year-old professional soccer player, scholarship on the line. Like, can we do this in 2 weeks? It's going to be tight. Can we do this in 4 to 6? Yeah, but don't mess it up in the first 2 weeks. And the biggest thing I want you to understand is with my checklist, you need to manage the external variables. It's not about the exercise. Exercise is just one variable to get them there. But if you have the outline, you can't mess up in those blocks. And that'll set them up for success. And they will absolutely love you. I promise. It just works. It's soft tissue healing. It's science. It's art. It's a progression. It is what I love. It's what I love, and I will share more and more of these case studies. I'm getting great feedback from you guys as listeners, and one of the things I'll do is I'll get emails from you guys like, hey, can you cover this? Or, based on responses from my Instagram at Chris Garcia DPT, you guys will give me feedback like, hey, I like these topics. Can you give more of this? Yeah, perfect. I'll do that. But just know at some point, like, it's all the same stuff. It's just the progressions. And if you don't want to learn the progressions, you're always going to be seeking out like, well, do you do internal rotation of that and the lateral rotation of this, and then you do hip mobilization? It doesn't matter, because the block is what matters. Just don't mess it up. Get them to week 2 so they can buy some time to get week 4 and then get them in practice at week 5. It didn't matter whether it was a posterior glide or medial glide. It just mattered. It mattered that you didn't mess them up. Don't mess them up. Like the general principle here. Do me a favor. You'll hear my outro on this thing. What I want you to do is, if you love this podcast, if you're like, man, I love hearing about the real side of physical therapy, sports physical therapy, and sometimes I get consumed by the data and all the little things and all the research, and sometimes it's hard to take a bigger picture. Here's what I need you to do. If you love it, I need your support here. I need you to leave me a 5-star review on iTunes. And what this does is it helps me reach more people just like you. I have some exciting news coming down the pipeline of conferences and things I want to do with students and new grads and established PTs. But I need your support. I need you to share this. Like, let other people know. Like, what is it that you love about this? Give it a 5-star and tell people what it is that you love. Like, it's real, it's practical, it's not just research, that it's like easy to implement, and it's like foundational, large, big picture things, and allows people to see what they really do for people instead of what they do to people. I am trying to get you to understand what you do for people, not to people. Understand that. Okay. All right. I appreciate that in advance. Give me a shout out on a 5-star review. I'll shout you out on my Instagram. I don't know. I'll put you on the newsletter. I'll do whatever it is. But I just need the support. I appreciate you guys tremendously, and thank you guys for the support. We are going to conquer the world and get people to think large scale as they grow, and that's my mission. So I hope you enjoyed the podcast. I hope you guys are staying safe and healthy, and you're enjoying life and living it. I know, because I am. All right. I will see you guys on the next episode. Thanks for tuning in. See you guys.